For seniors, independence is their identity. Over 90% want to age in their own homes. But a simple cut can be the first step towards losing it all. This isn't just a health issue. It's a threat to freedom. We'll expose the hidden care gaps threatening seniors and show how to fix them. So why are seniors so uniquely vulnerable? It begins with their skin. As we age, our skin is more prone to damage and heals much slower, giving infections a window to attack. It also becomes thinner, drier, and more fragile, meaning injuries happen far more easily and cause more harm. Because of these changes, a minor wound can spiral into a major health crisis. The stakes are much higher. This is amplified by chronic conditions like diabetes or vascular disease, which severely impair the body's ability to heal. The results can be catastrophic. Each year, over 16,000 diabetics in the U.S. undergo amputations from non-healing wounds. But biology isn't the full story. If we know the risks, why does this keep happening? The answer is found in the gaps in care. First, the old advice to let a wound air out. We now know this dries out tissue, slows healing, and increases infection risk. Systemically, poor wound management is a top complaint in senior care, often due to poor documentation and outdated treatment plans. Another gap is nutrition. Without enough protein and key vitamins, the body can't build the materials needed for repair. Underlying all healing is circulation. Good blood flow delivers oxygen to a wound, but circulatory efficiency declines with age. This is why encouraging even gentle movement can be a powerful treatment. It's about feeding the wound from the inside out. Let's see how this affects Eleanor. She's 78, a diabetic, and loves her home and garden. She gets a small scrape on her ankle. She cleans it and leaves it to air out, just as she was always taught. This is the first failure. Her diabetes slows healing, and the wound gets infected. Walking hurts, so she moves less, worsening circulation to her leg. Soon, she needs help with groceries. Her world shrinks. This loss of freedom leads to frustration and depression. Eleanor's story is a cascade of failures, one after another. But this is not inevitable. What does a better path look like? We asked why care fails. It fails when it's isolated. The solution is not a single product, but an integrated, team-based approach. This means nurses, doctors, dietitians, and physical therapists all working together, sharing info to create one holistic patient plan. Excellent teams use modern tools like advanced dressings that create a moist healing environment and fight infection. Technology also plays a huge part. Telemedicine allows specialists to monitor a wound's progress remotely, without a difficult clinic visit. This is the new standard: proactive, collaborative, and tech-enabled wound care. Now, let's rewrite Eleanor's story. Let's go back to Eleanor and her scrape in the garden. In a better system, the story unfolds very differently. A home health nurse sees the wound and uses a telehealth app to show a specialist, who immediately recommends an antimicrobial dressing. The full care team is alerted. A dietitian adjusts her meal plan for more protein. A physical therapist gives her leg circulation exercises. The result? The wound heals properly in weeks. Eleanor never loses her mobility. Her independence is successfully protected. We started with the deep desire of seniors to age with dignity in their own homes. We see now how a small cut can threaten that. These hidden gaps in wound care are not just a medical problem. They are a direct threat to the independence of seniors. For families, this means being vigilant. Take every wound seriously. Ask providers about modern treatments and a collaborative plan. And for healthcare leaders, this is a call to build systems that close these gaps. Let's protect the independence our seniors deserve.